biggest challenge is usually in behavioral control of behavioral or behavioral change at county level, which involves a multi-sectoral plan. So translating a multi-sectoral plan at county level has been a challenge. The second challenge has been availability and supply of essential medicines for primary care of NCDs, especially antihypertensive medications and simple diagnostics, diabetes medications and simple diagnostics, and also cancer screening for cervical cancer, breast cancer, and making sure that they are detected early and referred before they are too late. So these are some of the challenges that the county governments face, translating those policies and healthcare systems so that they align themselves to what the national agenda is. The human resources for health, the nurses and the clinical officers, have practiced in an environment that only dealt with malaria, TB and HIV for a long time. And therefore their knowledge and skills for advocating for healthy behavior for NCDs and screening for NCDs and giving primary care for NCDs has dwindled over time. And therefore they require new skills and education to be able to align themselves to this growing problem. With good planning, strategic planning, in terms of knowing the burden of the problems and having a good health strategic plan and investment in the system, health system at all levels, that is able to produce the desired results is important. So we already have a national strategy which can be broken down to a county strategy and an action plan at county level. And from WHO and other things that we've done, we have things we call the best buys, interventions that have been known to be cost effective and to work. Majority of them are on prevention. So using the community health volunteers who are very close to the community and usually serve quite a bit in preventing infectious diseases, the same narrative, they can actually be empowered to give information and to assist the population to have healthy eating habits, to engage in physical activity, to avoid tobacco consumption and excessive alcohol consumption, and to undergo screening programs to detect those who are developing hypertension, diabetes, or early cancer, and refer them early for treatment. And health centers also, education and equipment, basic equipment at health centers, so that those who have early problems such as diabetes, hypertension, and screening for cervical cancer, which has become very easy, and breast cancer, can be done at health center level where most of our population live and seek attention. All this can be done at that level if the health system is strengthened to be able to deal with this, and we have evidence on how it can be done.